A respiratory virus that mainly affects children is quickly spreading throughout the U.S., sparking some concern from parents and health officials. 140 people in at least 16 states, including Indiana, have tested positive for the virus known as enterovirus D68. That's caused schools to send letters home with parents informing them about the symptoms of the disease, and many hospitals are also imposing visitor restriction policies in an attempt to slow the virus's spread. Dr. James Laughlin joins us now to give us some more insights into what we need to know about the virus. Thank you so much for being here.
Thank you.
Now, we mentioned that this virus largely affects children, but who are the people that are most likely to contract this disease?
Well, anybody can contract it. In the majority of people, it'll cause mild symptoms, but the people that are most vulnerable are going to be young children and those children that have a chronic respiratory problem such as asthma.
And so adults can, as you said, get this as well.
Certainly.
How does it get spread? Is it somewhat like the common cold?
Exactly. You spread it by respiratory droplets, so coughing, sneezing, shaking hands, sharing eating and drinking utensils.
Is it dangerous? Can this virus be fatal at some point?
Yes, it can be, but that's rare.
What would it take to get to that level?
Well, primarily it would have to involve having a strain of the virus that was particularly bad and having that affect the person in an unusual way, plus having an underlying condition that would make it harder for you to resist that virus. Such as asthma, where when you get a respiratory virus, you have more coughing, more wheezing, more likely to get a secondary infection such as pneumonia.
Now, this isn't a disease that we've heard about much recently. Has it been around for a while?
Yes, it's been around for a long time. It was identified back in the 60s. It's the D68. It's always worse when there's a number and a name associated with it, but this virus has been around for a long time, just identified in the 60s. But enteroviruses are very, very common summer viruses. This is a broad category of common cold and respiratory viruses.
So why is it that it seems like we're hearing all about this now?
Because this particular virus, for some reason this year, has become one that has spread and become more common and been spread around the Midwest particularly.
Well, it's allergy season as well. Before we know it, the flu season will be here. How can someone tell the difference between the different viruses?
Well, they may not be able to tell the difference. Certain viruses are likely to cause more serious symptoms, such as influenza makes people have a high fever, lots of coughing, congestion. Other cold viruses may just cause a runny nose and a sore throat. What you have to pay attention to is how it's affecting you or your child, and if the child or you're a parent and you're watching your children and they have asthma, you want to make sure that if they all of a sudden develop trouble with their breathing and don't seem to be compensating well with the virus, with their respiratory status, then you'd want to seek medical attention. Is
that trouble with breathing, is that the only thing, or are there other symptoms?
That's the main thing. You know, if you have a virus and you're feeling really bad, you may not eat or drink, you can get dehydrated, so lethargy and not being alert for particularly an infant would be important to watch for.
And we all know the basic precautions to take during the season, you know, washing your hands and things like that. Are there other things that people should really keep an eye on doing to try to keep this virus from spreading?
Well, I think good hand washing is our mainstay in not sharing eating and drinking utensils, which kids invariably do.
Thank you for being here today. Very interesting.